and I haven't done hip presses in a little bit, so I thought I would do that. Get a little bit of close-up, maybe show a little bit of muscle action going on. I've been increasing the weight all around through pretty much all of my exercises, just by a couple of pounds though. Nothing major, just by a couple of pounds. The reason why I was doing the increasing weight is that I was trying to decrease the amount of repetitions that I need to complete my exercise routine, and that way I would have less of an opportunity for my hands to go numb whenever I do these presses. Then the dumbbells rest on my palms. That's our boy Blue today. He was having some seizures. He had a seizure yesterday, but he had some seizures a little bit later on today. So back to the hip presses. What I was doing through about most of it was I was having my elbows hit the bed at the bottom, and then I would push back upwards. This is in between the 5th set and the 6th set, so I was doing that hold. But I didn't allow my elbows to touch the bed whenever I was doing that hold. So, and actually the 6th set, actually the extra set that I did after the 6th set, I didn't allow my elbows to touch the bed at all whenever I was doing the reps. So, and the funny thing is the hip presses, it's supposed to work more on your triceps muscles, and it didn't really seem to be working more on my triceps muscles. If you look, it seemed to work more on my upper pec muscles. So that was something that I noticed. But I didn't look at the triceps muscles in the video, so I'm not quite sure. Maybe they were stressing, or maybe they were being flexed quite a bit. I'm not quite sure. But so our boy Blue, he had some seizures today, and the reason why he had seizures this time was because he ate too much this time, which he usually doesn't eat enough, and it's all based a little bit on his sugar level, from what I understand. So maybe he ate too much, and his sugar level went a little bit too high. And sometimes whenever that happens, then it's kind of interesting to see what his seizures are going to be like when his sugar level is too high, as compared to the normal with him. Looking at his seizures, how his seizures are, how his body moves and stuff like that. Whenever his sugar level is too low, do his seizure lengths, are they shorter or are they longer? Things like that are interesting to me. We try to cut it down. We try and do whatever we can to try and cut down the amount of seizures that he has, and we try and cut out seizures for him altogether. So it's nice to try and figure things out, and hopefully we can get it better for him so that he doesn't have seizures at all. But that's virtually impossible. It's very difficult to stop. He always seems to have a seizure at least every 2 months, once or twice every 2 months. So what I thought on after I did the after I did the final reps for the hip press, then I thought that what I would do is I would move my body, move my legs, so I would put my legs on the back of the bed. And so change the location, so I would do like a 180 of my body, and that way I could be laying on my belly. I don't think that we have that view very often of me laying on my belly, so I thought that would be kind of interesting to see. My right leg is laying over my left leg, so I'm going to pull. A lot of times what I do is I turn over to the side. I lay on my side a little bit so I can see my feet, see if they're crossed or not. If they are crossed, then the pressure after a while will cause skin breakdown, and that won't be very good. So every once in a while I like to check out my legs and make sure that my feet aren't crossed. And then whenever they are crossed, then I can uncross them by pulling out my right leg, or pulling my right leg forward or upwards and off of the top of the left leg.